Hello and welcome to the Working with Vulnerable and Diverse Populations webinar. Today's discussion will focus around the topic of bone and joint diseases, a prevalent issue of our aging population. What are bone and joint diseases? Who is most at risk? How can we be treated? These questions and more will be answered by the help of a resident expert and speakers. Ask some questions down below in the chat. We'll be able to answer them. Our first speaker is Dallin Russell, a health science graduate who enjoys golfing, reading, and skiing, a dental school fellow that will guide us along with osteoporosis. Our second speaker is Jared Pickard, a health science graduate who enjoys traveling, sports, and skiing, a nurse anesthetist who will discuss hip fractures with us. Lastly, we'll hear from Katie Ravston, a health science graduate who enjoys painting, dancing, and volleyball. She is a lactation specialist that is no stranger when it comes to discussing bone and joint diseases. She'll explain the in and outs of what is heavily affecting the elderly when it comes to arthritis and other diseases. Take it away, Dallin, with osteoporosis.
Yeah, so osteoporosis is a disease that thins and weakens bones, causing them to become fragile. So things such as bending over and coughing can cause fractures to occur. So my grandma, she has osteoporosis. And in one instance, I remember she was getting into a swimming pool and slipped and lightly bumped her hip against like the pool wall. And this caused a hip fracture. So she had to get surgery and it took months to recover. And this is partly due to the fact that with osteoporosis, the creation of new bone tissue can't keep up with the loss of old bone tissue. So if we look to the right, it shows the stages of osteoporosis. So in a healthy person, we see high bone density. And then as it goes to osteoporosis and then severe osteoporosis, we see the bone density decrease. This disease most commonly develops in the hip, the spine, and the wrist. And approximately 10 million Americans have osteoporosis. 8 million of them are women and 2 million are men. And there's also 44 million people with low bone density, which puts them in the high-risk population. So some symptoms and risk factors for osteoporosis. Pretty obviously, there is pain in the affected area. So people will notice pain in their hip, and their spine, and their wrist. There's also a loss of height over time. This is due to the fact that as bone density decreases, the bones tend to shrink. So if we look at the diagram in the center, as this person ages, their bone mass is decreasing. And we see that they develop a sort of stooped posture, which is also a reason for the loss of height over time. Bones also break easier than expected, as we discussed. And then same as with the case of my grandma. Some of the risk factors for this disease include corticosteroids, inactivity, so the lack of daily exercise, that's super important in preventing the disease. Gender plays a role. Women are at a higher risk than men. Things such as smoking or alcohol affect bone mass and bone density. Genetics play a significant role. Osteoporosis is a hereditary disease, which also explains why race is a risk factor. BMI, so having a higher body mass index, puts you at a higher risk for developing osteoporosis because your bones don't get bigger with an increased BMI, but they stay the same size, but your body mass is increasing and putting more stress on those bones. And then lastly, diet is important. It's important in preventing it, but also it can be a detriment in that it increases your risk if you have an unhealthy diet. So prevention, pretty simple. It includes calcium. So most people require 1,000 milligrams of calcium a day. This increases when you get older. Vitamin D is also important, so we get that from the sun. But most Americans are actually deficient in their vitamin D. And so through the use of supplements, that is important in preventing it. Exercise is necessary. We also see that bone density medications are used when someone gets osteoporosis. So that's usually the first treatment. The second treatment is hormone-related therapy. That is harder to adjust. Bone-building medications are the final stage of treatment. They're the least effective and often the most painful.
Perfect. So I see here we have a question in the chat from our audience.
Oh, okay, sweet.
Why are women higher supposed to osteoporosis?
Yeah, so women are at a higher risk for developing osteoporosis because of menopause, actually. So menopause directly affects bone density. So the female hormone estrogen is important with female bone health. And so after menopause, we see that estrogen levels actually decrease. And so that causes a decrease in bone density.
I see. Thank you. We'll now throw it on over to Jared, who'll discuss hip fractures. Take it away.
Right. Hello, everyone. Yeah, so I'm Jared. Like I said, I'm going to discuss hip fractures. So I didn't know that hip fractures were such a common thing until I started working at the local hospital. I was amazed to see how many people, especially women, would come in for different types of fractures. Basically, what a hip fracture is, it's when the bones become weak due to aging and other bone problems. And this happens, when this happens, it makes the bones much more susceptible to injuries. When simple injuries happen, like falling or bumping into something, bones can fracture. This is how hip fractures happen. So over here, just on the right, you can see a picture of the different types of hip fractures. And I just real quickly want to go over the anatomy of like the bones. So this weird bone here on top is called the os coxa. And then the bone down here where my arrow is pointing is the shaft of the femur bone. And this little bump on the end is called the greater trochanter. And as we can see here on the left, there's a crack near the os coxa. This is actually the most dangerous type of hip fracture because the os coxa is very fragile and it's hard to heal. So when it gets closer to that, it becomes more dangerous. Here in the middle, we have the extrascapular trochanteric fracture. And this is where the fracture hits right on the greater trochanter. And then over here on the right, this is the most common type of hip fracture. This is called the extrascapular subtrochanteric fracture. And this is basically where the fracture just hits the shaft. And yeah, that is hip fractures.
Thank you. We have another question here in the chat.
Yes.
How can we reduce the risk of hip fractures?
Very good question. Luckily, Dallin already kind of highlighted it a bit, but basically the main and best ways to do this are watching your diet, exercising, and simply just being careful. Like make sure you don't fall down, obviously. That's never good. Or just like watching where your bones could hit something. So overall, just being kind of careful with that. So.
Great. We'll now move on next to our resident expert, Katie, who will discuss arthritis and their forms.
So, arthritis basically is a disease that manifests, but they all have to do with joints and the detriment thereof. Arthritis in its different forms more commonly affects women, as previously stated, as well as obese persons. The two main forms that we're going to talk about today are osteoarthritis and rheumatoid arthritis. So osteoarthritis is the most common form of arthritis, and it is known as a wear and tear disease. This is because over time, the cartilage that surrounds the end of the bone deteriorates just with use. Some symptoms of osteoarthritis include pain, stiffness, tenderness, loss of flexibility, grating sensation, bone spurs, and swelling. As this disease progresses, the end result is bone-on-bone contact.
Some questions, Katie. Why are obese people more at risk for some type of arthritis?
So with obese persons, there is a higher weight that they carry around, and this puts more stress on the joints. The bones don't change as more weight is added, so the joints have to take more of that stress and that leads them to deteriorate more quickly than those who don't experience that.
Great. And what happens then after bone-on-bone contact?
So bone-on-bone contact is a very painful experience, but there are several treatments that you can use to help alleviate that pain, including water-based exercises, which promotes healthy joints, but also lessens the stress on them. Physical therapy, oral and topical medications that help with anti-inflammatory, and as well as suggesting weight loss to lessen the stress on the joints. If the disease progresses severely, then surgery is suggested.
Perfect. And to better get acquainted with rheumatoid arthritis, we'll watch a whiteboard animation Katie provided us detailing how it affects us and how it affects other parts of our body.
Arth refers to joints, itis means inflammation, and rheumatoid comes from rheumatism, which more broadly refers to a musculoskeletal illness. So rheumatoid arthritis is a chronic inflammatory disorder that mostly affects the joints, but can also involve other organ systems like the skin and the lungs as well. All right, so a healthy joint typically has two bones covered with articular cartilage at the ends. Articular cartilage is a type of connective tissue that acts like a protective cushion. It's a lubricated surface for bones to smoothly glide against. One type of joint, like the knee joint, is called a synovial joint. A synovial joint connects two bones with a fibrous joint capsule that is continuous with the periosteum, or the outer layer of both bones. The fibrous capsule is lined with the synovial membrane that has cells that produce synovial fluids and remove debris. The synovial fluid is normally a viscous fluid like a jelly part of a chicken egg, and it helps to lubricate the joint. To help serve these synovial cells, the synovial membrane also has blood vessels and lymphatics running through it. Together, the synovial membrane and the articular cartilage form the inner lining of the joint space. Rheumatoid arthritis is an autoimmune process that's typically triggered by...
Perfect. And so after watching that, Katie, what are some complications from rheumatoid arthritis?
So with the progression of rheumatoid arthritis, people can experience rheumatoid nodules, lymphoma, carpal tunnel syndrome, and they're at an increased risk for catching other infections. The other types of arthritis that can be observed are fibromyalgia, lupus, and psoriatic arthritis. Today, about 30.8 million adults experience osteoarthritis in the US, and it is projected that this number will continue to grow as we continue to have an aging population. There are several ways, as we've mentioned before, that you can manage and prevent these types of diseases. This includes exercise, maintaining a healthy body weight, maintaining a healthy diet, as well as talking with your doctor and being aware of how your body changes over time and how you need to adjust for said changes.
Thank you very much, Katie, for the interview portion of our segment. Now, I hope you all have been listening. It's time now for our comprehension quiz. And to help us out, our resident expert and speakers will be helping us out with that.
Yeah, so we'll just run through these really quick. So the most common form of arthritis is osteoarthritis. Number two, which of the following is not another type of arthritis? That's C, edema.
And then number three, a non-disclosed intrascapular hip fracture is the most dangerous type of fracture. This is true, it is the most dangerous.
And more men have osteoporosis than women is a false statement. More women have it than men. And about how many people in the US have osteoarthritis? The answer is 30.8 million.
Perfect. We'd like to thank you all, audience, for joining us here today, and especially for our speakers and our resident expert. We hope you join us next time. Have a great day. Thank you.